until it gets, everybody gets it figured out. I wouldn't want to be a snowplow driver. I decided that.
Have you?
That would not be one of the things I would apply
Not a
for.
calling to you?
No, not at all.
I guess I need to build
Not
that
at
into
all.
my budget, 100%.
You're live.
Okay.
Thank you. All right, good morning, everyone. Welcome to our Public Health and Human Services Board meeting on this Tuesday, December 20th at 8:38 a.m. I'd like to call the meeting to order. First item is the approval of the consent agenda. That includes our meeting agenda, the minutes, a few other items there. Is there anything anyone would like to remove from the consent agenda to discuss further? Else I'd entertain a motion there.
I move to approve the consent agenda.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
I'll support.
Thank you, Commissioner Svaleson. Motion and support. Any further discussion? Hearing or seeing none. All in favor?
Aye.
Aye. Opposed? Motion passes unanimously there. Thank you. Moving on to item 3, introduction of new staff. Nancie Demming. Good morning. I'll hand it over to Allison.
We're thrilled to be welcoming Nancie to the Public Health and Human Services team. Many of you have met Nancie already through her work with the Rural Child Care Innovation program here in Cook County and Grand Portage. She's been deeply engaged in the work of child care for essentially her career, and locally over the last several years that we've really been working across sectors to look at the child care gaps in Cook County and how to address those in meaningful ways. So we're really excited to have Nancie come on board. She joined us last month on the same date as our PHHS board meeting. She's already been jumping right in, and I think is going to say a little bit about what she's been focusing on over the last month. So please join me in welcoming Nancie.
Thank you so much, Allison.
Yeah.
And thanks to all of you. I was talking to Pat just briefly before the meeting, and it really is, I'm still in just this wow stage. I'm very humbled and honored to be able to be here and be a part of this work that the county's moving forward. I just want you to know that as I have meetings with people over in the state and I talk a little bit about what we're doing in Cook County, everybody else is wowed too. They're like, oh, that's amazing. It's amazing that your county is coming together to try to increase child care spots and support providers. So I just want to give you a quick update. I believe Allison might include in her report, we had our first meeting of our Child Care Solutions Subcommittee last week. I think it was last week with the snow. So that was amazing. We had people from the community that haven't been engaged yet, who now are being engaged in helping to talk about how we're going to be able to sustain some of these child care solutions that we're working on. We have been assigned a family child care consultant from DHS to kind of help us walk through the process. What are all of the rules from the county side that we do as licensor? I'm very familiar with the rules from the provider side, but how do you enforce all of those as a county? So we meet with them every week, Grace Bouchard and I, as they're kind of leading us through the process, getting us the training that we need to have for that. We plan to do a press release, hopefully later this week, that will be talking about all the different initiatives and programs that we have together for childcare, including what we are calling the Wage Enhancement Program that's going to be administered by the county. You probably have heard that we also received a $180,000 grant from Deed for Child Care Solutions. And I just kind of want to give a little update as to the different areas that that's going to help cover. So there will be some funds that we will use for recruitment and outreach all throughout our community. Just educating people on the importance of childcare, how it builds the workforce, also being able to try to find new providers and support them in their roles. There's startup and expansion grants that will be run through EDA for new providers or those who are expanding their businesses. We also have a piloting a subsidized slot program. Most childcare providers do not make any sort of profit for the first year or two, and it's a big risk, and it's a big risk for providers to try to expand. So we think, yep, they'll get their slots filled, but it still could take a little bit. So we have a temporary subsidized those slot programs for up to 6 months with providers who are willing to start or expand their programs. We have some hiring bonuses in there, a lot of training things, but something that the providers are super excited about is we plan to develop a substitute pool, so we have less closures, whether it's a family provider that wants to go on vacation, or it is one of the group family homes that we have to be able to use those substitutes. So those are just a few of the different things that we're working on. Finalizing the mechanism for how providers will apply for the wage enhancement program, working with our fiscal team, figuring out how that's going to look best for the county. So if you ever have any questions, please feel free to give me a call. And I love people who send me solutions and ideas. So even if you hear them or think of them in the shower, just send me a little note, give me a call, because yeah, there are no ideas that will be wasted as a part of this team. So again, thank you for for taking a chance and welcoming me to be a part of the county team.
Well, thank you, Nancy. I think we are also still in the wow stage, just having you as a part of the team. So thank you for joining. And yeah, the work that you've done before you were part of the Cook County team was amazing, and it continues to be so. So thank you very much for stepping up there, and really looking forward to all that you're working on. Any questions for Nancy?
Just a big thank you.
Oh, thank you.
Yeah, we're so
Thank you.
excited.
Yes, like I said to Pat, sometimes I think these things kind of come full circle, and I think I've been doing all these different things, and then, wow, maybe it was just preparing for helping to lead this. So it's pretty awesome.
Well done. All right. Well,
Absolutely.
have a good,
Get some of that work done.
yeah, have a good rest of your day, and thank you for joining us this morning. And then that moves us down to item 4, staff report with Martina Johnson. Good morning.
Good morning. Thank you for having me. I know you have a really busy agenda today, and I just want to say that I am not 100%. My family has been dealing with the flu, and I was in a meeting with Pat yesterday and was talking and kind of had an out-of-body experience, like my words aren't quite making sense. So I will have an opportunity for questions at the end.
Thank you.
So I have come to the board nearly annually to give just information on adult protective services, what that means in the state and what that means for Cook County. Today, I just wanted to, because I've covered that many times with this board, I just wanted to give more of an update. So go ahead to the next slide. So in review, Cook County Public Health and Human Services is responsible for investigating reports of adults who have been maltreated and has a role in creating safety for vulnerable adults by connecting them with resources and supportive services. It is the statutory responsibility of Cook County Public Health and Human Services to provide adult protective services and to respond to reports of suspected maltreatment of vulnerable adults made under the Vulnerable Adult Act. And adult protective services include intake, response to emergency adult protective service notifications, investigations, and safety planning to remediate and prevent maltreatment experienced by vulnerable adults. So the Department of Human Services has developed a Minnesota Adult Protection Policy Manual, and this was last updated in August of 2022. And these are some of the core principles guiding our work. Sometimes adults need support. Adult Protective Services engages in adults who are vulnerable to abuse, neglect, engages adults who are vulnerable to abuse, neglect, and exploitation, and those who support them using trauma-informed, culturally appropriate, and person-centered approaches in assessment, investigation, safety planning, and service initiation. So those are words that you probably hear often and wonder, what does that mean? Trauma-informed is looking at a person's life experience and considering the traumas that they might have experienced and how that's affecting the decisions that they make today. Being culturally appropriate is looking at a person's culture and understanding or trying to understand how that might affect how they want to live and being respectful of that. And person-centered approaches is just always keeping the person at the center. What do they want? What's important to them? And balancing that with what's important for them. Social work is really, our goal is to always work with the person, let them decide, provide information, resources, support, but they get to be in the driver's seat. Another core principle, choice and values are balanced with safety. So respect for the cultural identity and dignity of all involved guides, protective services, while we balance the choices and values of the person who is vulnerable, with support for them to be safe from abuse, neglect, and exploitation. Again, talking about what's important to them, what their cultural identity is, and bringing in ideas. And maybe you're having to bring those ideas in multiple times because they're not open to them the first time. But being respectful along the way while also providing information and support. And then the state has a focus on outcomes. They really have been gathering a lot of data and analyzing it. And one of the principles of our work is tribal, state, and county partners commit to continuously improve the adult protection system and services, remove barriers, eliminate disparities, and focus on outcomes of safety and dignity for the adult who is vulnerable to abuse, neglect, and exploitation. Next slide. So some of the challenges in adult protection, just kind of wanted to talk about this today because we don't talk about this very often in our presentations. One of the biggest challenges I would say is balancing public expectation with what we actually have the authority to do. So I think social work in the past, and I don't know, this was before my time, but I hear sometimes about how a social worker came and they just told my dad that he has to go into a nursing home. And a social worker came and said, okay, it's time for you to get out of this house and get it cleaned up, and so we had to do it. And that's not the way it works anymore. We can't just go and just tell people what to do. We can't just remove them from their homes. We don't have that authority. So it can be really hard for people to see someone that they feel is vulnerable and struggling and not see change and wonder, what are you doing? What is the county doing to help this person? So balancing that is challenging not only for the people that are in the community and not seeing everything that's happening behind the scenes, but it can also be hard for us as staff because we oftentimes want to be able to do more to remediate a situation, but we're not able to, just given limited authority. Limited services, that's also a huge challenge for us. I imagine you've heard this from other specialty areas, but in adult services and adult protection, we have very limited services for homemaking. We really don't have any services in Cook County to address hoarding. We have limited nurses that can provide home care services and limited nurses to provide bathing in the home. So we're seeing people that are kind of on the edge and living in the community in unsafe situations, and we're putting the services in that we can, but a lot of times it's not enough. So the lack of services sometimes contributes to vulnerable situations. And then changes in policy. DHS has taken an initiative in 2022. They just introduced some new measures in August that are great. I think that they're going to really enhance the services that we provide. An example would be looking at self-neglect, not as something that we need to investigate, but more as something that we could introduce services and work alongside, which we already are doing, but previously it was you had to open an investigation and look into it, and you had to come up with a determination at the end of that. Are they engaging in self-neglect or are they not? And the policy has changed so that it's not framed in that way anymore. So changes in policy just create challenges because it's more to learn. Every time something changes, you need to learn how to put it into practice. Go ahead to the next slide. Just wanted to give you some quick data for Cook County in this past year. So January 1st to present, we've received 26 reports of adult maltreatment. Less than 10 of those have involved the need for emergency protective services. That's where we're required by the statute to respond immediately to ensure that the person is safe. The most common allegations that we have received include self-neglect and financial exploitation. At the start of 2022, we had 3 staff fully trained in APS, and that was Lynn Wright, who retired in June, and then Olivia Bonander, who left last month in November to take a job in the private sector. So now it's just me that's fully trained in APS, and you're probably looking at the numbers and thinking, well, that's fine because we only have 26 reports of adult maltreatment. But that my job is more than just adult protection, and so is the job of the social workers on my staff. They wear multiple hats, so this doesn't get to be anybody's specialty, and that can be problematic because there's not one person. I have been doing this for many years, but there's nobody else that has done this and has that experience and knows the ins and outs of the law and knows the region-wide resources and state resources. So that is problematic. And if I'm gone or I'm sick, there's nobody that, I know my staff, they're great. They're here today supporting me. They could step in and do what they need to do, but that's going to be a really uncomfortable position for them to be in, doing something that they haven't received the training to do. Go to the next slide. So 2023 initiatives, train in at least one staff to provide APS investigation support, and I've talked with Rachel Schauer. She's one of our new care coordinators, and she is on board with learning how to do adult protection investigations as well. So she's going to hopefully be able to take that training in January. And then in 2022, I was named to be part of an APS partnership group that DHS is sponsoring. It's a pretty small group of representatives from counties across the state. And DHS staff, adult protection staff, to work on issues that are facing adult protection in Minnesota. We are looking at improving our structured decision-making tool. We're looking at the discrepancies or the inconsistencies in how reports are being screened in and screened out. We're looking at disparities. So it's exciting. It's a group that meets monthly. It's done through Teams, so we can meet virtually, and it's people from across the state, so that's really cool. So I'm really excited and proud to be a part of that group. And then in 2023, if I find the time, I'm hoping to be more proactive than reactive, because this year has been just a lot of turnover and responding to that. But I'm hoping to do some community training and also some training for our partners in law enforcement and whoever else might want to take part. So that's the end of my presentation. Any questions?
Commissioner Storlie.
Thank you. Thank you, Martina. The sentence that really struck me was, the lack of services puts people on the edge.
Mm-hmm.
So there's you, and then you have 2 assistants. What would help? Hiring more people? What would help?
Well, it's not, I'm not necessarily speaking about our agency. I'm more speaking about community resources.
Mm-hmm.
So we're short-staffed in all of our community resources, really. So the ones that we use most frequently to support people home care, they have, I think, 1 full-time nurse and maybe 2 part-time. They only have 1 home health aide, and that's part-time too. So they can, and they serve the entire county. So they're spread really thin, and they're not able to see people as frequently as they had in the past. I remember when they were fully staffed, they could make 3 visits a week to a person, and now they are lucky to make 1 visit a week. And that's like ensuring that someone's taking their meds appropriately, checking blood pressure, maybe checking blood sugars. So that's a really important service. People getting assistance with bathing helps prevent falls. So if we don't have that service and someone's like, obviously I need to bathe and I'm going to do it myself, and then they fall, that's just causing, more problems for them and creating more needs for them ultimately. With in-home support, which is within our agency, we have a waiting list of over 20 people. We have a really core group of providers, 12 to 13 providers, that are meeting the needs that they can, but they can't take on any more clients. And so we've got all these people waiting that could use some help with cleaning or cooking or errand running. And again, if you don't have the help, you're going to try to do it yourself. And that can lead to a fall. It can lead to an accident if someone drives and they really shouldn't be driving. It can lead to people eating food that maybe if they're low vision, they're not noticing is spoiled. They go in their refrigerator, they're hungry, they're going to grab that food. So just thinking of so with our care center, they have done a phenomenal job of adjusting how they operate due to their staffing shortage. But they haven't been able to take any new residents in for months. So that leaves people who want to stay in the community and are hanging on till they get that care center bed, leaves them hanging on possibly in an unsafe situation, and then sometimes they just have to move out of the community to get the level of care that they need. So it's more things like that. Transportation, we have with the AUA bus, it's not going to Duluth once a week anymore, and that's really challenging for people that need to get to Duluth for medical appointments. So it's just across the board that we have a shortage of people to do the work.
So it's really casting the net into the community in general, working like with Care Partners. I know at the last meeting, Care Partners was talking about, more recruiting on their part than would help you. And, it's just, it's the wider net.
Yes.
So thank you for explaining that, because I think we need to take that all in consideration. It isn't just public health here, it's the wider community that needs to some way work along with you too.
We all work together, really, to support people, and
Right.
that's how you see change, is to have, it's not just the county coming in. People don't necessarily respond well to that all of the time, so it's utilizing those community partners that can, maybe a person might be more accepting of, Care Partners, I'll take help from them, or it's sometimes even having those conversations with a person about who are your people. And we don't often think about, like, well, my neighbor might be a resource for me, or this person that I sit next to at church, or my niece or nephew. A lot of times people don't want to bother others, but sometimes it might be all that it takes is to have a neighbor check in once a day, or someone bring a warm meal to that person a couple of times a week, and just have contact with them. Maybe someone go and grab their laundry and do it for. It's just like small things can really mean a lot, and go a long way in helping gain trust and helping to improve the safety of a situation. Because we don't like I talked about, when we have people doing things because they can't find other people to help them, and they really shouldn't be, because it puts them at a fall risk or it puts other people at risk. That's where we come into play, and when things get really vulnerable and unsafe.
Thank you.
We're fortunate that we have a very strong community in Cook County, and that's, really works to our advantage when we're talking about community partners too, and just engaging with neighbors or friends and family or church members, and it's important to remember that it's not just by chance. That's through actual work of building community and maintaining community and strengthening community. And so when we talk about this more holistic approach with other partners, I think that's important to keep in mind. Some of the issues that you're talking about, in my mind, comes down to, again, housing. If there's not workers for doing these jobs because there's no housing, then we're not going to solve that. And we as the county board and the HRA are doing all kinds of work there, and it's really wonderful to address things. And then also just, there's a lot of talk in the news about nurses' wages or health aid wages or home care wages. All of that is a part of the conversation too. So we need to be cognizant of those issues as we're trying to find solutions and work together to build things stronger, in my opinion.
I think that's true, but what concerns me is the turnover in your organization, Allison, and the numbers of people who come and go and come and go. That's the hard thing for me to understand on how we can do anything to help with that piece, because it's the turnover from 3 to 1, and I know the other work you do, Martina. There's just no way we're serving our community as well as we should.
Yeah. Well, and yeah.
Especially with our aging population, who knows is out in the
Absolutely.
woods that we haven't even been able to let them know that there's a service for. That's a real concern from the work I do as well, is how do you identify the people who really need food? Because what we want to do is feed people here, and it's really hard to get that info out.
Yeah, very, very heartbreaking, stressful, difficult roles, and so there's certainly that factor. And then again, also, I think wages could play a factor
Yeah.
into retention, but also just cultural support, right? Building a culture that really supports those workers and the work that they do. And by and large, I think we do a good job, but we can always do better. So, any other questions, thoughts? Commissioner Sullivan?
Question for you, Martina. You talked a little bit about the issue of financial exploitation, and that not just here in Cook County, but that's been in the news statewide a lot in recent years. What are some ideas or suggestions about educating our community and our elders that we can provide that may decrease the amount of exploitation in that area?
I think the more public education we can do, so whether it be on the radio, on WTIP, or in the newspaper, or however we might reach people, whether it be through social media, because we do have people that utilize that as a method of getting information as well. But just to educate people of the different types of scams that are happening. I know Sheriff Svaleson has periodically done that. I think it would be great if we could even do that quarterly, just to keep it fresh in people's minds, because there's always new scams that are happening. The scammers are getting more and more skilled at getting money from people. I think also removing the stigma. It happens to everybody. It can happen to you and me. You don't have to be vulnerable to be a victim of a scam. So reducing that stigma and saying, if it happens to you, reach out. We are finding that financial institutions seem in the last year to have adapted a policy that if someone is a victim of theft from an account, they make a vulnerable adult report. So we've been seeing that, and that is good. Again, the person that is the victim isn't always a vulnerable adult, but at least if they are, it opens up that door for us to make contact. But yeah, I think just talking about it more, we hear about it periodically, but just keeping it fresh in people's minds and finding different ways to reach people to talk about it. I'm not going to think, it's the Minnesota Attorney General's office. They have some really great resources for protecting yourself from scams. And that's something that we could even share on our Facebook page. I know that doesn't reach everybody, though.
One of the things I was thinking about is potentially doing some kind of a class at the hub for a group of people and kind of getting some momentum, so we could maybe, as you suggested, quarterly offer something to get a group of people together, share experiences and ideas. But I think it's something that's really needed. I appreciate you addressing it.
That's a great idea. Thank you.
Commissioner Storlie.
That reminded me, Commissioner, that in the West End, we have senior lunch at Birch Grove, on Wednesdays, weather
another-
permitting. And I try to coordinate a little program at times, so that would be something good that could bring up. Plus, I go to the township meetings.
Yeah.
So, if we can just kind of start the word in the new year about this and at least let people know, educate, Boreal, the paper, radio, whatever it takes.
Well, the other thing we talked about yesterday on the call I was on with Martina is even putting a flyer into the Meals on Wheels programs.
Yeah.
Or into the Ruby pantry bags, or even if we can get grocery stores to throw it into the bags at the end of the counter once a quarter or something like that. Because the statistics show that people over 55 like to read things, like to put things on their counter and read it later on as well. So that could be another more hands-on kind of thing that might work too.
That's a good idea.
And a lot don't have computers, too.
Well, exactly. And everybody's afraid, to your point.
Yeah.
The scam thing has got people really afraid of using certain things.
Yeah.
And the older they get, and so, or younger too, you're right on that. We're all vulnerable. So, the
Yeah.
old-fashioned way, bulletin boards, flyers, the new-fashioned way, social media, there's many ways as we can figure it out.
Yeah.
Any other questions, comments? I just wanted to thank you for talking about just the cultural aspect of your work. I think that's really important. And it's also the dignity and respect for that people involved, because it just really puts the value on people, and I really appreciate that. One of the items that we've talked about talking about at our local mental health advisory council is hoarding, and we haven't gotten there yet, but it's an issue I'm not super familiar with, but I feel like I have a periphery sometimes of those behaviors.
Don't we all?
Yeah. But then when I hear about the actual diagnoses or whatever, it's next level. So I have lots more to learn about that, but I think that's an area that we have interest in supporting our community. And thank you for sharing that we don't currently have that level of support. And I just also wanted to say, I know we don't have all the resources that we need, or we can't address all the community needs, but every little bit helps. And so what we can do makes a huge difference, and we can build off of that. So thank you. One other idea I had for APS training is maybe our coordinated crisis worker could be a good maybe knowledge base there, but no, it's just a pilot program. But I think there's a lot of opportunity to build more bridges within the community and kind of find different avenues to address issues. So that was all I had. Thank you, Martina, for sharing the presentation and the annual update there.
You're welcome. Thank you for your time.
Feel better.
Appreciate it.
Thank
Yeah.
you.
Well, that moves us down to item 5, the director's report. Allison, I'll hand it over to you.
Sure. Just start with a gratitude to Martina for your leadership locally and at a state level on the MAXA APS partnership. So grateful that you've stepped into that role and sharing your knowledge with at a state level in that role, and locally with the Aging Coalition and all the great work across systems with other partners that's happening within that group as well. Thank you, Martina. Thank you. I'll start with the staff update today. I am very happy to share that we have filled 3 vacant positions in the last month, which is huge. John Speaker is starting as our new behavioral health clinical supervisor. John will be on site here in Cook County full-time on January 9th, but he has already met with the team a couple weeks ago. He met with staff to learn more about each of them and their roles. He's starting with some remote onboarding work before starting here full-time on the 9th. John is a licensed clinical social worker. He has a wealth of experience, most recently with MACV, the Minnesota Council for Veterans, as their Director of Housing Subsidy and Healthcare Navigation. Previously, John was the Director of Client Services with Catholic Charities, so a great deal of experience supervising behavioral health programs in a variety of settings, nonprofit, urban, rural, and even has some county experience at Beltrami County. I'm also very excited to see Abby moving into that children's mental health and skills position that was approved on the consent agenda this morning. Abby has been with the behavioral health team since June in a similar role, providing therapeutic support services primarily to adults, but some youth as well. So this will allow Abby to expand some of her skills in a case management role. She also worked with us previously as a temporary public health educator as a part of our COVID response team. And Abby also has experience in a classroom setting. So great skills, great to see Abby move within the organization in this new role. It does create another vacancy, but we can manage that. Also on today's consent agenda was the hire of Arielle Charlier. She's joining us also on January 9th in that social services case aide role that's been vacant for several months. Arielle comes to PHHS from the Sawtooth Mountain Clinic Pharmacy as a pharmacy tech. So she has some great experience both in data entry, health records, and customer service, which are all very essential in this case aide role. Arielle will support our human services team with a variety of tasks, including file maintenance, data management, working in SSIS, which is our state social services information system, and entering service and payment informations into other state systems. So we're really excited to have those 3 key roles filled at the end of the year. Nancie also came on board since our last meeting. You got to hear more from Nancie this morning. We continue to recruit for 2 vacant positions. One is our family services case manager position. That one has been vacant since June. So really struggling to fill that position, working in child protection, child welfare, parent support outreach. We also have a second vacancy in adult services that was more recently vacated with Olivia's resignation last month. We have 3 interviews scheduled over the course of the week, and we have some folks who are interested in multiple vacancies, so we're hopeful to fill both of those positions before the end of the year as well. Since we last met, we did some additional analysis of our turnover rates within the department and wanted to share with you all that of the 12 positions that have turned over in 2022, and this does include resignations, retirements, and internal transfers. So that increase from 11 to 12 represents Abby moving into this role, creating a new vacancy in her current skills worker role. Of those 12 positions that turned over, 4 of those individuals took jobs in remote work. So that represents 30% of our staff are leaving the department for jobs with much larger organizations that we simply can't compete with. This is a new phenomenon for us, for our department, both the increased rate of turnover and to see so many people leaving their roles with the county for remote work. And that can be for a variety of reasons. It might be more flexibility, less stress, higher wages, more advancement opportunities. Those reasons are multiple, but it is significant that 30% of our staff are leaving for remote work.
So when you say remote work, Allison, you mean they can work from home?
Yes.
Thank you.
Yep, so previously we would be competing with other organizations locally. People might leave the community or retire. This is just another factor in our ability to recruit and retain qualified staff as an organization.
Commissioner Hawkins, please.
Of those 4 that moved to remote work, are they locally employed businesses they moved to, or out of the county businesses they're working for?
Out of the county. Yep, so these are big firms like health plans or state agencies. I believe, working from memory, that these are all outside the community remote jobs.
Allison, do you see any opportunities for our organization to better accommodate that option for us? I mean, I know we've made an effort, and I'd say a great effort, to allow more flexibility and working from home during the pandemic and beyond. Are you hearing feedback for anything beyond what we've changed in our policies?
I think we're limited in some of our positions in the ability to have those be fully remote or even hybrid. For example, Martina, there's no way to conduct an adult protection investigation with a tablet or a smartphone. You know, the nature of our work requires that person to person, person to family, relational, face-to-face work. Some of the waivers that were in place during the pandemic to allow us to continue to provide essential services without the risk of being face-to-face, some of those waivers have been codified in state law, but many of those have sunsetted. And the requirement is that we do provide that in-person service.
Well, if you do see opportunities, please share them with us and the team, because I think that could be helpful. We need to do everything we can for retention. So, Administrator Yorkie.
Yes, thank you, Mr. Chair. You know, one question that I get frequently is, what are we doing to try to avoid having people leave the organization? Or if they've made that decision already, are we doing exit interviews and gathering whatever information we can to use for future recruitment and retention? And I just want to say for the record, yes, turnover has been a really big issue for us this year, and we'll talk about that more in the county board meeting. But it is something that we are tracking, and we are doing exit interviews and trying to gather as much information. And in fact, Allison's department has been doing stay interviews. So even before people provide notice that they're leaving, we're proactively having conversations with them to understand, you know, what are the aspects of your job that are satisfying, what are some dissatisfiers, and what can we do to address those. We have to be doing that. We have to be proactive in that way, because there's just so much turnover going on. And as Allison said, the competition that we face now is not just with local employers or regional employers, it's really national.
Good.
Yeah, and I've been doing a lot of reading about this, and I'm not as trained or professional as Administrator Yorkie. It's just interesting to hear varying perspectives on the efficacy of, well, I think certainly stay interviews, 100%. I've been hearing conflicting analyses on exit interviews, and just how useful that information is, but like you say, we need to do everything we can to try to, get information about how to improve. It also, it reminded me just of the presentation from Gordon Graham at AMC about employee reviews. He said throw them out. I was like, what? That seems counterintuitive, and I think the reason he was saying that is just because it's challenging to do follow-through with that information. So I really appreciate you elevating that conversation and working with that information.
Yeah. And to be clear on the point of employee reviews, I mean, there should always be feedback
Yes. Yep.
from supervisor to
Should be a
employee.
direct, yeah.
I think what he was talking about is just frequently the way annual reviews are done.
Rubber stamps.
It's just really ineffective,
Yeah.
right? Because frequently there isn't that constant feedback cycle between employee and supervisor. And if you're just doing that one time a year where it's like, here's what I think of your performance, then you're doing it wrong. So.
Yeah, well said, thank you. And thank you, Allison, for your work with your team, trying to better understand what's going on and how we can better stabilize things.
Thank you, Commissioner Mills. And one more thing that I'll say related to our limitations or some of the drawbacks for remote or even hybrid work is just the nature of our work, the complexity, the level of risk involved working with vulnerable families and individuals, that we rely so heavily on a collaborative team-based approach. And for one person to be working fully remote and isolated from a team is risky. So having that in-person integration needs to be a part of any hybrid work arrangement that we have within our department.
Could be you're basically saying we'll have a stronger team when we have that in-person hybrid, and I believe that as well.
But the key word is hybrid. At least you're trying to do a little bit of both, which is great.
Right.
All right, I'm going to move us on to department updates. I'm going to keep my report short. I know we have a big agenda on the commissioners' meeting following this. So I'll start with an update on COVID and other respiratory illnesses. COVID-19 community levels have been low and medium for the last month here in Cook County. However, there is a high level of other respiratory illnesses circulating at this time. This includes COVID, influenza, respiratory, syncytial RSV, and more. I did not pronounce that correctly, RSV. Influenza season is in full swing statewide, and there is more flu activity than we would expect to see at this time of the season, with K-12 schools in particular, over the last 4 years. There are many other respiratory illnesses at the community, and there are a common set of recommendations that apply to limiting the spread across all of those illnesses. Hand washing, staying home when you're sick, covering your cough, and wearing a mask in public indoor settings can all prevent those respiratory illnesses.
I've heard that before somewhere.
Yeah. We like to just throw that in every month. There are more specific recommendations for isolation with COVID-19. Testing and masking after exposure are particularly important, and we continue to make those materials available throughout the community at a variety of sites. You can call Public Health at 387-3605 for any questions about respiratory illnesses or how to access high-quality masks and tests. Staying up to date on vaccines are another important part of protecting oneself and lessening that overall community burden with the high rates of respiratory illnesses. Currently, both vaccines are available for all of those over 6 months of age. Vaccination rates are low. Only 3.5% of those in Cook County are up to date with COVID-19 vaccinations. Vaccinations are available locally at Sawtooth Mountain Clinic by calling 387-2330 to set up a nurse visit or as a part of a routine provider visit. We expect that the bivalent vaccine for those 6 months to 4 years will be available sometime in the next 2 weeks at Sawtooth Mountain Clinic, and will distribute a media release as soon as those are available.
I've been feeling guilty of late because I had not yet got my bivalent dose or the flu vaccine, and the reason I had been putting off the bivalent is because I had COVID the last week of September, and so I was like, okay, I know how, but I got it now. I feel great. Both arms were sore, but that was my energy was a little low, but that was the worst of it. So, and it was super easy at the clinic. Just really appreciate their work and their help. I'm sorry, go ahead.
You already heard about the child care initiative from Nancie this morning. That subcommittee met on the 13th to review both the background on current initiatives, proposals related to that wage enhancement program that's in development, and updates on other funding opportunities to support child care. As Nancie mentioned, we'll be working on a media release to share more information. I want to give a brief update on the coordinated response pilot. Matthew came on board in October in this new role for our department and community to coordinate and provide daytime crisis response services. Matthew is providing real-time debrief and after-action review structure, working to interview our partners in law enforcement, human services, and at the hospital. Promoting learning across systems, looking at what we expect to happen and what the reality is and how to reconcile those two. Also working with our after hours and weekend responders at the Human Development Center, as that is really the foundation on which this daytime crisis program is built, is our existing after hours and weekend process. It's very complex. Every question that is answered leads to more questions, but just so grateful to have Matthew in this role and for the cooperation of our partners in achieving a more coordinated system for our community members in need.
I've had the chance to interact and speak with Matthew as well, and yeah, I think he's wonderful for the role. Of course, he has a very large heart, and he cares deeply about people in our community. And he also has a real critical eye and just ability about different systems and how things can change, or what is the roadblock and that sort of thing. So really appreciate him in that role and the role itself. Want to thank you again for bringing that to us to give a trial here. Very hopeful, but also what a difficult job. Herding cats is maybe not appropriate, but just the complexity, like you said, of it is extremely difficult.
Lots of factors
Mm-hmm.
involved in developing a more robust system.
Mm-hmm. Different policies of different organizations and the law of the state, and everything there.
A few other things that we're promoting in the behavioral health realm, both within public health and our human services team, is Narcan training upcoming at the Cook County Community Center Log Cabin on the 9th of January at 5:30. This is organized by Harm Reduction Sisters, who is one of the consortium partners on our HRSA grant for substance use prevention, treatment, and recovery. We are publicizing that flyer on social media and by email with our partners, so I'm happy to share more information if any of you are interested in that. Also looking at future training opportunities, as there has been a high level of interest in the training.
Bless you.
Also on the radar for more community-based training is our public health team who wrote a grant to the North Shore Healthcare Foundation to offer mental health first aid training in Cook County. Bless you, Melissa. So I'll hope to have more information to share in the next month in terms of training dates and outreach. We will be doing targeted outreach for individuals who work with youth One of the modules is specific to youth mental health first aid, and one is a more general mental health first aid. And the idea is that these are skills that anyone can have to be able to help their families, their neighbors, their friends, their community members.
I'm sorry, I keep having things to chime in on your reports, but I see that both as developing those skills or learning those skills, but also just having that awareness in our community and you know, and that compassion to understand more of what's going on and understanding that we all have many facets of our life and that there's many things going on in all of our lives. I think that's just a really good bridge there.
Absolutely. Last thing I want to share is kudos for our economic assistance team. I feel like I often have good things to share recognizing that team and their work. They're in the process of completing a corrective action plan for our SNAP management evaluation review. I think it's every 2-year process in which DHS reviews many aspects of our work administering the Supplemental Nutrition Assistance Program, ensuring that we are meeting all of our obligations as it relates to outreach, customer service, program access. One of the new components in the review this year was posting information on our website for people with limited English proficiency to ensure that they can connect with interpreter services. And I want to recognize Melissa in particular for putting that together quickly and getting it up on the website. And our response to that corrective action plan review is being used by DHS and as an example for other counties in terms of the responsiveness
Nice.
of that new requirement. So thanks, Melissa.
Thank you.
And Allison
Well done.
Kramer and everyone else who's involved in that work. And that's all I have for updates. Happy to answer any other questions.
That weren't interjected in the middle of your
Weren't
report?
interjected.
Yeah. Anybody else have any questions or comments for Allison? Well, thank you very much, Allison. I just typed my password in wrong. That moves us down to items for board action. Nothing for this meeting, and that'll bring us down to the committee reports. We'll start with the Active Living Steering Committee. Commissioner Svaleson.
The Active Living Steering Committee met December 6th. They meet the first Tuesday of every month with partner updates, reviewed and continued to update the strategic plan. The next meeting will be January 3rd during the meeting to get organized for next year for everyone, so that won't be a commissioner for that one. But that one will be an Active Living Steering Committee and Safe Routes to School meeting, and Christina Matson can provide any updates from that meeting.
Does she know that we won't be able to attend?
I'll send her a note.
Okay, thank you. Moves us on to AEOA. We meet tomorrow, but I did receive a letter from the AEOA director, Scott Sahoric, and it's not too long. I would like to read it for us all. There's lots of challenges, of course, but they have such a huge impact, both in our community, but even larger in our region. It's just really impressive. So it says, thank you all. 2022 is almost in the books. As I reflect on the last year, I feel the need to say thank you to our board of directors and staff for your efforts in yet another challenging year. It's times like these when I feel extremely lucky to be surrounded by such a great group of people who do all they can to make lives better for our friends and neighbors in the Arrowhead region. It has not been easy to accomplish what we have, as we have had some staff retire and others leave us. It does feel like the tide may be turning, though, as we have had quite a few new staff join us, and they bring a variety of new talents and much-needed energy to our efforts. We do have some leadership changes, as Skip Ferris is retiring as Head Start Director, and Gabe Johnson will be stepping in to replace Skip. Jack Larson is retiring as Transit Director and will be replaced by Brandon Nurmi. The split in the Housing Department has taken place, and Angela Neal accepted the position of Housing Director for Homeless and Property Management. Departments have had their own issues as transit hasn't seen a new bus in quite some time. Senior and Nutrition Services has been extremely busy with their food efforts. Head Start has been busy moving into new facilities. Employment and Training has had their hands full figuring out their new business plans with the reorganization with their partners, and the Housing Department continues to see major growth in the Weatherization Department. We are scheduled to close today on our building for the new homeless shelter in Hibbing. The new building will have 54 rooms and will be operational shortly after the first of the year. The building will be purchased for $1.66 million and is slated to have another $1.5 million for the rehabilitation of the building to fit our new use for the buildings. The rehabilitation will be happening throughout the next year. St. Louis County has provided the funding for the purchase and safety upgrades for the new shelter. As always, this agency cannot do all the things it does without the support of our board of directors and the efforts of our spectacular staff. Without your effort and dedication, there would be a lot less than these good things happening across the Northland. Please be safe, be kind, and enjoy this holiday season with friends and family. Thank you all for everything you do, and together let's make 2023 an even better year. Sincerely, Scott Zahoric. And it's a very nice thank you, first off, but just one of those items that's a really big deal in my mind is that homeless shelter purchase in Hibbing. Huge for St. Louis County, and the St. Louis County Commissioners have really been pushing hard on this and just did a phenomenal job putting it together, and it actually happened very quickly. It was impressive, so just wanted to recognize a lot of that good work and some of the changes that's happening in AOA. It's significant with those retirements. Both Skip Ferris and Jack Larson have been, I think Jack's been there over 20 years, both of them. There was somebody who was also leaving who had 42 years experience in the organization, and that's kind of been happening fairly regularly. So it's not so much the great resignation as the great retirement.
Those baby boomers.
Yeah, get you every time. But the work that's been done, by the boomers and just those staff that are willing to stick with it, it's phenomenal. So yeah, tomorrow we have our meeting, and I'm looking forward to that. Moving on to the Arrowhead Health Alliance. We did meet, and there's a little bit of a challenge with some of the contracts for services. They have, DHS has split out different contracts, and so there's, I think, quadruple the number of requests instead of having things bundled together, and so that means DHS staff has to process 4 times as many requests, and that's slowing things up. And so unfortunately at our meeting we were not able to finalize contracts, but the board gave me authority as chair to sign whenever they're put forward. So but otherwise I think the funding from the Moose Lake project is coming into Cook County, and that's helpful, of course. Not increased by any means, but we were afraid it was going away for a bit there, so it's good that we got it. Moving on to item D, Arrowhead Regional Corrections. Commissioner Hawkins.
Well, we met last Friday, the last meeting of the year. We recognized the 3 commissioners who are leaving the board. Frank Jewell and Wade Pavlik have a lot of experience on that board. They will definitely be missed, but I have their phone numbers when I have questions. But there's another board that, they've been on that board for many years, and I have really appreciated their insight when we're discussing issues with corrections. So I will miss them there.
Thank
But
you.
really nothing else to report, just regular business.
Okay. Thank you for bringing that up. That's something I meant to and forgot with the AHA. Kevin Aide from Coochiching County is also not elected again, and so he was one of the founding members of AHA. And then also he's the vice chair at AOA. So some big holes in our community organizations that we're going to have to fill, or hopefully someone will step up there. Moving on to the Community Health Board, we had our annual meeting. It was wonderful. Frank Jewell a part of that too, retiring. He was able to duck out of that because he had another meeting. So we weren't able to give him the full glory he deserved. But it was a great time in Duluth, and one of the first times that the whole board and staff have met in person. Well, since before COVID. We've had some in-person meetings, but they've been hybrid, and so we haven't all gotten together. But per usual, my favorite part is the medical consultant, or I don't even know what the term is. The good doctor's report on community health, and this time it was about daylight savings time and just how that affects our bodies and the statistics around the nation, and just getting into some of the data on sleep cycles, and I learned quite a lot. My understanding is the bill that's being proposed kind of works against what we would prefer in the northern climate as far as our biology is concerned. And I believe the AMA is, American Medical Association is lobbying to, hey, don't do it this way. And so the debate will continue. I hope something changes. One suggestion was just to go halfway, instead of 1 hour, just do half hour, lessen the pain on everyone.
Oh, man.
Yeah. I was thinking 29 minutes would be fun, but. That moves us down to item F, Cook County Local Advisory Council for Children's and Adult Mental Health, and Rana's not here, so Allison said she would be willing to report on that.
As I look back at the notes, I think I incorporated most of the updates from our meeting in my report. So I don't have anything to add unless you do, Commissioner Mills.
Just that a large part of it was with Matthew Baxley and talking about that position and some of the challenges and the hopes there. And that was just a really good conversation. And again, the mental health first aid initiatives. So thank you for that update. Item G is Cook County Restorative Justice.
We did not meet in December.
Okay, thank you. Moving on to the Council of Aging, Commissioner Sullivan.
All right, well, I just want to share a little good information from the Cook County Council on Aging. There's a clothing drive that has been going on, and Upper Lakes Food is helping those in need for the holiday season. They select a community every year to gather clothing and bring it and share it with the community. And so Upper Lakes has this week dropped off lots of clothing, mittens and hats and coats and things for people of all ages, just not seniors, but for all ages. And so we really want people to know that they can come to the hub through Thursday of this week from 8 a.m. to 4 p.m. to look for those things that they need. And it can be not only something they need for themselves or for a child and their family, but for a gift that someone needs.
Oh, yeah.
So we really want to encourage people to come to the hub and participate in that.
Cool.
Yeah, thank you for sharing
Great
that.
opportunity.
It's huge. Moves us on to Emergency Preparedness Committee.
And we meet every other month. We did not meet this month, so we'll have a report in January for you.
Thank you. Moving on to Healthcare Planning, Commissioner Storlie.
We met the first Friday of the month, so all this news is kind of old, but I'll pick out some good stuff. Allison also joined us virtually. Julie at Care Partners is now really trying to recruit more people to work with her in her agency, because there's a lot of, as we just discussed with public health, a lot of gaps, and so she's working with that. Light Up for Life, that happened a couple weeks ago down at the Johnson Heritage Post, where you thought about other people who are in need. Kimber reported something I thought really interesting, that they're working on a psychiatrist in telehealth to help them work with mentally disturbed people who are brought there. And there's not like a whole lot, but there's enough that they're concerned now, and they want to have somebody on hand that can help them. Is that the way you understood that?
Yes, so my understanding is that the hospital is in development through, or in the process through Wilderness Health to offer telepsychiatry services in the emergency department to help stabilize individuals who are experiencing a mental health crisis before they're able to provide or locate a placement out of county.
So that is a concern about her department. They are able now to do nurses' aid testing at the hospital, which I think is interesting. Lindsay reported they had a very successful Luna Fest, which was in November. And they have 6 new volunteers to support some of the work that they're doing. Val reported that they're working on workforce shortage, also solutions for all of that. And the agency is 30 years old.
Wow.
Isn't that something? Yeah, the foundation. And Kate Serba reported that working with higher ed on work opportunities. So I was impressed with higher ed because they had a course on overland drivers for trucks. And they had a success with several people who took the course, and they're out there somewhere driving semis or larger trucks than a Suburban. So that's great that they would do that. So that's that, and then I'll move on to NACO, which right now we're still getting support and ideas about what to bring forth at the national conference, which will be in February. So we're sorting all that out, and in January then we'll get down to a number of important legislative things to consider at the NACO national meeting. That's my report.
Thank you, Commissioner Storlie. Moving on to the Northeast Minnesota Office of Job Training, did not meet. Moving on to North Shore Collaborative, did not meet. But I'd just throw a plug out there, as always, for any community organizations that are looking for grant opportunities. North Shore Collaborative is a very powerful, flexible, local opportunity. So I'd encourage applications there. And then the Public Health and Human Services Advisory Council.
We have a meeting in January, so I don't have anything new to report right now. However, we will be doing election of officers then, so there might be new people here. I'm not sure how that is all going to go, but like everyone else, we're certainly soliciting topics of interest. So if anyone has any they'd like to bring forward to the advisory committee, we are certainly willing to listen, and they can contact Allison or I.
Thank you. For the good of the order, Commissioner Svaleson.
Well, when I was doing active living steering committee, one of the things in active living right now, I've neglected to state it from a safety perspective. Everybody knows we had the warmer weather, the sloppy snow and all that type of thing. And I noticed as I was walking across to come in here today, we want everybody to be able to get out and be active and do those kind of things, but don't forget there's that underlying ice that's under this fresh snow, and wow, does it make it challenging somewhat. So get your gripper devices on your boots and shoes, and then you can get out there.
Yeah, exactly.
Anybody else? Then I would entertain a motion to adjourn.
I will make the motion.
Thank you, Commissioner Svaleson. Is there support? Thank you, Commissioner Storlie. We are adjourned.
Thank you.